Hello and welcome back to A Doctor's Diary, practical medicine for everyday life. Today we will be discussing Campylobacter infections, one of the most common bacterial causes of gastroenteritis worldwide, and one that we encounter frequently in everyday medical practice. This topic is especially relevant in primary care and emergency medicine, where patients often present with acute diarrhea and nonspecific gastrointestinal symptoms. Understanding the epidemiology, transmission routes, clinical presentation, and management of Campylobacter infections is essential for making correct clinical decisions and preventing complications. In this video, we will go step by step through the most important clinical facts you need to know about Campylobacter infection. Campylobacter species are gram-negative, spiral-shaped bacteria. More than 30 species have been identified, but the most important human pathogens are Campylobacter jejuni and Campylobacter coli. Other species such as Campylobacter lari, Campylobacter fetus, and Campylobacter upsaliensis may also cause disease in humans, although less frequently. These bacteria are widely distributed in nature and commonly colonize the gastrointestinal tract of animals. Campylobacter infections occur worldwide. In Germany and most European countries, infections occur more frequently during the warmer months of the year. The most affected groups include children under 5 years of age and young adults between 20 and 29 years old. Campylobacter enteritis represents tens of thousands of reported cases each year, making it the most common notifiable bacterial gastrointestinal infection in many European countries. Campylobacter species are found in a wide range of animals, including wild animals such as birds, farm animals such as poultry, cattle, and pigs, and domestic animals such as dogs and cats. The bacteria can survive in the environment and in food, especially at lower temperatures. However, unlike some other intestinal pathogens, Campylobacter does not multiply outside the host organism. Transmission is primarily foodborne. The most important source of infection is poultry meat, especially chicken. Common infection routes include consumption of raw or undercooked poultry, unpasteurized milk, contaminated drinking water, contact with infected animals, and swimming in contaminated surface water. Food contamination frequently occurs during slaughter processes when intestinal contents contaminate the meat. Fresh chicken meat sold in retail stores is often contaminated with Campylobacter. Person-to-person transmission is uncommon but possible, particularly in young children, due to the low infectious dose required to cause illness. A special clinical situation occurs with Campylobacter fetus infection, where mother-to-child transmission may occur intrauterine or during birth, potentially leading to miscarriage, neonatal sepsis, or meningitis. The incubation period is typically 2 to 5 days, but may range from 1 to 10 days in some cases. Many infections remain asymptomatic. When symptoms occur, they usually present as acute enteritis. Prodromal symptoms may appear 12 to 24 hours before gastrointestinal symptoms and may include fever between 38 and 40 degrees Celsius, headache, muscle pain, joint pain, and general fatigue. The most common clinical symptoms include diarrhea, abdominal pain or cramping, fever, and fatigue. The diarrhea may be watery and in some cases bloody. The disease usually lasts up to 1 week, but may persist longer in immunocompromised patients or vulnerable individuals. Although most cases resolve without complications, rare but important complications include reactive arthritis and Guillain-Barré syndrome. There is also possible association between Campylobacter infection and the development of irritable bowel syndrome or chronic inflammatory bowel disease. Diagnosis is confirmed primarily through stool testing. The gold standard remains culture from fresh stool samples. Additional diagnostic methods include antigen detection using enzyme immunoassays and molecular detection using PCR techniques. Culture remains important because it allows antibiotic resistance testing, which can guide targeted therapy when needed. In most cases, Campylobacter infection is self-limiting, and supportive treatment is sufficient. This typically includes fluid replacement and electrolyte substitution to prevent dehydration. Antibiotic therapy is not routinely recommended, especially if symptoms are already improving by the time microbiological confirmation is obtained. However, antibiotic treatment should be considered in cases of severe disease, lack of clinical improvement, or in immunocompromised patients. The first-line antibiotic is usually azithromycin, while ciprofloxacin may be used as an alternative. Cephalosporins are generally not effective against Campylobacter and should not be used for treatment. Whenever possible, antibiotic therapy should be guided by resistance testing results. Prevention of Campylobacter infection relies heavily on proper food hygiene. Important preventive measures include thoroughly cooking poultry, avoiding raw or undercooked meat, boiling unpasteurized milk before consumption, and preventing cross-contamination in the kitchen. Hand hygiene remains a critical preventive measure, especially after using the toilet or handling raw meat. High-risk groups, including infants, pregnant women, elderly individuals, and immunocompromised patients, should avoid consuming raw animal products. Patients with active symptoms should remain at home and follow strict hygiene practices to prevent transmission. In healthcare settings, isolation may be necessary in cases of severe diarrhea to prevent spread to other patients. In children younger than 6 years, return to daycare or school is typically allowed 48 hours after symptoms have resolved. Campylobacter infections are notifiable diseases in many countries, meaning that laboratory-confirmed cases must be reported to public health authorities. Usually within 24 hours, rapid identification and reporting help control outbreaks and prevent further spread of infection. Campylobacter infection remains one of the most common causes of bacterial gastroenteritis worldwide. Recognizing the clinical presentation, understanding when supportive therapy is sufficient, and identifying situations where antibiotics are necessary are essential skills in everyday clinical practice. Thank you for watching A Doctor's Diary, practical medicine for everyday life. If you found this video useful, stay with us for the next episode, where we continue to simplify practical medicine for everyday clinical work.